state strategies for seamless birth to 5 services, strategies for summer birthdays, and local infrastructure supports. So what we hope to accomplish today and the goals of the webinar are to learn about federal and state resources on transition from Part C to Part B, Section 619. I'm going to show you some things on the ECTA website. We also want you to learn about the transition strategies that have been used and are currently being used by Missouri and New Mexico that address policy coordination, technical assistance, and other infrastructure supports. And then we've allowed time at the end for you to ask questions either through the chat or through your computer speakers or your phone, and to have a little bit of discussion. At the call in December, it was quite lively at the end. There was a great deal of discussion. It was a smaller group like we have today, and folks did speak up and use the chat. We also want to let you know that the content, the audio recording, and the PowerPoint slides from the call in December on the option or the extended Part C option are available online. We're real happy to be working with Pam Thomas, the Part C coordinator from Missouri First Steps Early Intervention Services, and Sandy Dragmeister at the University of New Mexico Center for Development and Disability. And then, of course, I'm Kathy Whaley, and working with Evelyn Shaw today. We're both from the ECTA Center. This is a snapshot of some of the selected resources that we have worked with OSEP to either create or post. I'm going to show you one of these specific resources. The link to the ECTA Center transition website is at the bottom of slide 5. You can also simply Google this and it'll show up. But we have different sections, and this is a section on the OSEP guidance. And we thought there's so many folks that are new in their role that they might not realize that these resources are here. This is something that we developed when we were NECTAC in 2010, and then updated in 2012 when the Part C regs came out. And this is a very useful resource that was done in partnership with the Regional Resource Center program that was funded at the time and approved by our colleagues at OSEP. It was reviewed carefully by them. And it gives you what is permissive and what is required, and where you have degrees of freedom with late referrals to Part C. This is the page that shows you based on the timeline. And it is linked to the APR indicators for transition for Part C. So it tells you what you must do, and it tells you what you may do. If you continue to use this document, the second page goes into the Part B requirements, because there are things there that are very important too. So we encourage you to look at this and the other resources on that page. The transition from Part C to 619 and other programs webpage also has resources developed by states. These are just 2 of the categories of state resources that we have on that page. We also have interagency agreements, intra-agency agreements, and special state initiatives. But we wanted to show you a snippet from the state training materials and the state guidance subpages, because you see here that New Mexico and Missouri are featured. So the resources they're going to talk about today and the work they're going to share today, you can also find on this website. And with that, Pam, I'm going to turn it over to you to tell folks about the Missouri process.
Okay, sounds good, Kathy. Good afternoon, everyone. This is Pam Thomas. I'm the Part C coordinator for Missouri. In Missouri, as Kathy mentioned, the Part C program is commonly referred to as the First Steps Early Intervention Program. And I'm here today to share a little bit about what services look like in our state. Next slide, please. As you know, Part C is unique to each state's program, and I want to tell you a little bit about Part C in Missouri before we talk about Part C extension services. Education is the lead agency in Missouri for Part C. We have regional contracts for service coordination, and the map that you see on the screen shows the 10 different regions for our service coordinator contracts. Then we have a separate vendor process for our therapists or our providers. They serve each of these regions, but it is a separate process from the contract. So they enroll through a central finance office and have an agreement with the state to deliver services. We often have providers that cross over these regions and serve more than one area. Our eligibility criteria for developmental delay in Missouri: for Part C, it's a half-age developmental delay in one or more area. And for Part B, 619, it is 2 standard deviations in one area or 1.5 standard deviations in 2 areas. Next slide, please. So due to this difference in our criteria between Part C and Part B 619, Part C is a little more rigid than 619. So approximately 70% of the 3-year-olds in Part C are eligible for Part B 619. So when considering our extension plan, we were looking for a process to prevent a gap in services and promote a seamless transition from C to B, especially for children who have summer birthdays in term 3 over that period of time. Okay, so in Missouri, we have been providing some services for children over age 3 prior to the 2011 federal regulations, which included the Part C extension. Missouri had to develop a Part C extension policy to align our procedures for summer services with the regulations. The regulations have 3 state options that may be taken if the state chooses to extend services for children over age 3. Those 3 options are on your screen. The first option is serving children from the age of 3 until the beginning of the school year following the child's 3rd birthday. The second option is the same, from the age of 3 until the beginning of the school year following the child's 4th birthday. And the third option is from the age of 3 until the beginning of the school year following the child's 5th birthday. Can you go back just a second to the previous slide? Thank you. So in Missouri, our definition of extension is that parents of children with summer 3rd birthdays may choose to continue in Part C over those summer months. As I mentioned, we extend those services for the summer 3rd birthdays. That does fall under option 1 here on your screen, but we recognize that we are not fully implementing option 1 because we're not serving all children over age 3 until the following school year. We are only serving the children over age 3 until for those summer months, so children with 3rd birthdays that fall in that period of time. Even so, Missouri went ahead and wrote an extension plan as part of our state regulations. It does follow all of the procedures that are required in 303-211 for option 1. And, you know, maybe one day we'll be able to fully fund option 1. I'll talk a little bit more about that in a bit. Okay, so for the Part C extension criteria, as I mentioned, our state regulations indicate what that definition is. Our summer 3rd birthdays who are eligible for that criteria have to have a 3rd birthday between April 1 and August 15th. There are a few Part C states that have an opt-out policy, and for those of you who know that is where the family has a choice whether to send directory information to the local educational agency or not. And so for Missouri, when the parent opts out of that transition activity, then the Part C extension program is not available for that child and family. It's no longer an option for them. Okay, next slide, please. A few more notes about our extension criteria in Missouri for parents to consider. The parent can choose whether to transition to early childhood special education, which is Part B 619, at age 3, or continue in Part C after age 3. If the parent chooses to transition, then the Part C program ends the day before the child's 3rd birthday. Or if the parent chooses to continue in Part C after age 3, the child must meet the additional criteria on your screen in order for the services to continue. And that is, the child is determined eligible for Part B 619 before age 3, or the child's eligibility determinations in process. So that means the service coordinator has sent the referral for the child to the school district and they're working on that. So once eligible for the extension and the parent chooses to continue with early intervention, then the child participates in the extension program until the day before school begins in the fall following the child's 3rd birthday. Okay, next slide, please. So just to kind of wrap up and give a little bit of a data picture to what that looks like in our state. We've been working on we will be working on calendar year 2018 data, but for now I wanted to share with you calendar year 2017, which was shared at the summer conference, the summer IDIO conference. So for calendar year 2017, we had 10,861 children that year with an IFSP at some point in time in the year. And then for children who had 3rd birthdays between the time frame for our definition, April 1st and August 15th, it was approximately 1,814, and that's about 17% of the total children with an IFSP. So inside of that 1,814, how many children and families utilize the extension program in our state? And that was 857. So about half of the children and families who are eligible for extended services took that option and continued on through the summer months with early intervention services. The other half either did not want to transition to the school district, or they transitioned to the school district. So another thing I mentioned earlier was cost. We all know money makes the world go round, and so this is a big piece of what we look at when we look at extended services. So our total program cost, in a fiscal year or calendar year is about $45 million. We know from tracking our cost per child that it cost about $3,100 a year to serve that child for all services and administration involved in serving a child and family. But the services cost per child are about $2,300. So bottom line is, if we're going to fully implement the extension plan for all 3-year-olds to continue in the program until the fall following their 3rd birthday, not just the children with summer birthdays, we know that we would have to have approximately a little over $5 million, probably a little bit more than that, because our data from 2018 is indicating we have more children, and our budget is probably going to be closer to $52 million for that growth in children is what we're expecting. So I'm guessing maybe more like $5.5 million. And so really what we've been looking at is just not just the funding, but also the capacity to be able to serve. When we all know when we add more children, we need more therapists or providers, we need more service coordinators, and without extending those services to all 3-year-olds, in Missouri, our Part C child count doubled in size from 2008 to the end of the fiscal year 2018. So in that time frame, we doubled our children. So if we served 5,000 children, we now served 10,000 children, just as a rough number. So I think there are definitely some additional considerations that a state's Part C program needs to think about. And so that is something that we always kind of have in the back of our mind. At this point in time, we are able, and we're very pleased to be able to serve children with summer birthday over that summer months, because they would not be receiving services from the school district in many situations. Okay, and I think that wraps up a glimpse of what Part C Extension services look like in Missouri.
Thank you, Pam.
I'll toss it back to you, Kathy.
Thank you so much, Pam. And we have doubled the number of people are on the line now, so I'm going to just mention this again, that we're holding the questions for Pam and for Sandy until Sandy finishes her presentation. So jot down your ideas. You can also put something in the chat, but just know we're going to attend to it after Sandy presents from New Mexico. But we are going to give you that opportunity. So with that, I'm going to turn it over to you, Sandy.
Well, thank you, Kathy. And I am Sandy Drangmeister, and I am the statewide transition coordinator for New Mexico. And today I have with me Catherine Quick, who is the Public Ed Special Ed Bureau 619 coordinator, and Jonetta Martinez Pasillas, who is the Department of Health Family Infant Toddler transition lead. And so at the end, if you have specific questions, I thought it would be helpful to have both of them here to answer those questions. The transition process, as we all know, works best when we have a collaboration of all of the parties involved. New Mexico has found that bringing community partners together in collaboration, and these are transition teams, which I'm going to talk about, has really helped ensure that families are fully informed of the process, and that both Part B and C are better able to meet their timelines related to transition as a result of this collaboration. And similar as Pam highlighted the infrastructure for Missouri, New Mexico is a little different. The Department of Health Family Infant Toddler Program is the lead agency, and the service coordinators are early intervention agencies and staff contractors through the Department of Health. The providers are Department of Health contracted early intervention agencies, which include also New Mexico state supported schools, the New Mexico School for the Blind and Visually Impaired, and the New Mexico School for the Deaf. The eligibility criteria for Part C is an evaluated discrepancy between chronological age and developmental age of 25% after correction for prematurity in one or more areas of development. And then for Part B, it's a delay of 30% or more in one or more areas of development the children may be eligible. So since 1999, the New Mexico Early Childhood Transition Initiative has really worked to improve systems across New Mexico. New Mexico's transition initiative supported the formation of a statewide transition teams, and currently we have 31 teams across the state that continue to meet in the regions of the state. And so here is a little diagram of the New Mexico Transition Initiative. You see we have a steering committee that questions or issues that come up around the state get filtered to the steering committee, and they help provide guidance and look at where we can maybe clarify in our guidance document or support training across the state. So the community transition teams that I talked about have really been very valuable in New Mexico. Each team's members vary based on the local partners in each region. School districts and the early intervention agencies are part of transition teams, as well as other partners with whom they share the responsibility of transitioning children. So some of the early intervention agencies, the state-supported schools, and the home visiting programs and other partners, they might be part of more than one transition team, but most schools only participate on one transition team. The purpose of the transition team is really to provide a place for members to come together to address transition procedures at the local level. because each agency may have internal procedures that are unique to them. Each team meets based on an agreed upon schedule that they outline in their memorandum of understanding. And in some cases, we have teams that meet monthly, others meet 2 times a year, some meet quarterly, but really it's a focus of the responsibility of each member of the team attending these meetings. Teams also support parent involvement at the team meetings, which is really helpful for the whole team to hear a parent's perspective on their experience and to kind of smooth out where things might not be working, or sometimes it's easy for the focus to get away from the child and the family. Each team develops their community transition memorandum of understanding, and they review that at a minimum annually. They also refer to it, during a team meeting if they come up and they find that they have an issue or concern or something's not working smoothly, they'll refer to that transition MOU. Next, Kathy. The transition coaches. So the University of New Mexico Center for Development and Disability Early Childhood Learning Network, and that's a mouthful, but we have contracts with the Department of Health Family Infant Program, and within that contract, they support us with funding to support 14 transition teams with coaches. And then the New Mexico Public Ed Department Special Ed Bureau provides funding for us to support 7 transition teams. So we had a shortage of transition team coverage, and we reached out to the New Mexico Regional Education Cooperatives, and they stepped up and they support 6 transition teams statewide. And then for those other teams remaining that may not have a coach as transition coordinator, I support them using Zoom or by phone conference anytime that they need support. The role of the transition coach is to support the team in achieving smooth and effective transitions for children and families. They also ensure that all of the members that come to the team understand the vision and mission of the transition initiative and help facilitate an understanding of the transition process. I don't imagine that New Mexico is unique in this, but we have a lot of turnover in the early intervention field and also in public education. And oftentimes the folks that are working to support transition aren't aware of some of the transition processes. And so the transition team provides a way to share that information and support transition at the community level. The coaches also address technical assistance needs. They help provide resources to the team. Again, they have encouraged parent involvement. They serve as a resource in the development of their MOUs, and they really don't control the team. It's really the role of the team that comes together, and they identify a lead for the team meetings. They often have a note taker and a timekeeper for these meetings. And it's really a nice way for them to share community resources and what supports are available for children. The coach may also be a person to call upon when there's questions outside of those meetings. This is a picture. Oh, that's okay, Kathy. Thank you. This is a picture.
Sorry about that.
No problem. This is a picture of one of our teams in the southeastern part of New Mexico that has come together to review their memorandum of understanding. And you can see there's quite a group gathered around, and they have their MOU up on the screen there. But all of the MOUs really walk through each step in the transition process. So they have a template that they work from, and it lists out each step from referral, notification to referral, transition planning, who's responsible, all of the different agencies. In New Mexico, the MOU is tied to funding at the LEA level. So they submit their transition MOU with their Part B IDEA funding. This is also a place where they clarify roles of all individuals and also define timelines and what each person agrees to do. Next, Kathy. Here's a screenshot of the transition MOU library. Kathy mentioned some of the resources that she shared early on. And so you can see under the completed memorandum of understanding, there's a list of all the different transition teams and their MOUs. And we find this really helpful when teams meet, or if there's an issue or somebody's not feeling like in their area transition's working well, they can come to this site, pull up their transition MOU, and review what they agreed to at in their local area.
And Sandy, for the participants, early on in the webinar, I showed you the link for the transition page, and under interagency agreements on the state resources page, we have the New Mexico link to this library. And
Right.
then you'll also be able to access anything on the NAPR on the left as well.
Right. Thank you, Kathy. So you can see that we do have quite a few different things there. And we also, that next slide is great. We also began adding, and it's been updated. I unfortunately didn't update this slide, but the transition meeting schedule for 2018-2019 is now available. But this provides for all team members, if they think, oh yeah, I think we have a meeting in January, not sure when it is, they can scroll through this and look up when their transition team meeting is, who their coach is, and just a nice at a glance transition team meeting schedule. Next slide. And as Kathy mentioned, also on our website, we have a team toolkit that supports teams in understanding what the role of team members are, the intent, things to consider about communications and how to address issues and concerns. There's the transition team MOU workbook. We have tip sheets that highlight what the purpose and intent of a transition team is, what happens at a transition conference, who is the lead. And also we have information about tribal protocol. In New Mexico, we have quite a few tribal entities, and reaching out to those tribes to get their participation, there's specific protocol on how to do that. And so we support each of our transition teams in doing that. And we also have video available on transition. This is also the links for the New Mexico Early Childhood Transition Initiative, the New Mexico Department of Health FIT website, and the New Mexico Public Education Special Ed Bureau website. And with that, I think that concludes our presentation from New Mexico.
Thank you, Sandy. Lots of good information from New Mexico and Missouri, and just a reminder of how you're going to access these materials later. We will have this recording and the PowerPoint presentation on the events page with the webinars, the same place where you went to join the webinar today to register. So these materials will be ready shortly, and we hope you share them with other folks in your state. Now, we know that some of you do have questions. There were a couple of things in the chat that I'm going to scroll back up to. And if you have, Christine Wagner is going to help me. So I'm going to start with the chat. But if you will raise your hand, you can go to the right of your name, and you should be able to click on a icon in words to raise your hand. Christine is going to watch that, and she will unmute you so that you can also talk through your computer or your phone. So we had a question from Alice, and
I have it written down, Kathy, if that's helpful.
See it. I got it. I scrolled up. Thanks, Ev.
You're welcome.
Yeah, I think this is Alice, maybe in Connecticut, I'm not sure. But Alice says, since families in Missouri have the choice to continue Part C over the summer, and 50% do, question mark. Don't the LEAs have to have all of the resources available to provide FAPE at 3 anyway? Is there any cost savings to LEAs? And we've already answered about the recording. Pam, how would you respond to that?
So, hi, Alice. If you could take the slide back to the last slide that I provided the data. I think that's the slide where her question's coming from. One more.
This one?
Yes. Yes. So what I had shared with you is the number of children in the state with an IFSP, and then the number of children who have birthdays between this time period. So those children in that first bullet of 1,814, that just means that they had an IFSP and they have a birthday between that time frame, so they would be potentially eligible for the extension program. So that number of 50, that percentage of about half of the children are eligible for the extension, use the extension. So remember, we've got a percentage of children who in our state who don't qualify for early childhood special education or 619. And we also have a percent that opt out. That's about 5% of our families opt out of going to the school district. And then even with the ones who don't opt out, we later have some families, about 10%, who do not want a referral to the district. So I would guesstimate that half of the children stay in Part C, 25% of them do not want to go to the school district for one reason or another. Either they've opted out, they're not eligible, or I'm sorry, they go, but they're not eligible. And then about, I would guesstimate 25% of the children go ahead and transition to 619 at age 3. And you're absolutely correct. The district would have to have the resources available for that child at age 3. But as the district is included in that transition activities with that child and family and First Steps, then they would know that the family would be coming in later in the fall when school begins. I would suspect there is a cost saving to the school district because I believe in Missouri the cost per child for 1 year for a school district is about $10,000. And our cost per child for a year is about $3,000. So I would suspect there's a little bit of cost savings there for that partial period of time over the summer. And I think that the other part of that isn't necessarily money, but I think it's planning. So for that district to know, hey, this group of children have already been determined eligible for the school district services, but they will be coming in the fall so we can plan accordingly. I think when you're trying to set up your classroom, you're trying to set up what resources that you might need. All of that is really better situated for the district to have that time to plan and have that ready to go for the following school year.
And we also had from Andrea Brunel, if I'm understanding correctly, in Missouri, a family can choose to continue with Part C even if the child has a summer birthday. Sorry, if the child has a summer birthday, okay, even if they do not qualify for extended school year in Part B when they turn 3. Is this a correct interpretation, Pam?
Yes, that is correct. So one of the slides indicated that, I think if you could go back one more slide, Kathy. Here on this slide, I had shared that the child either has to be determined eligible for Part B 619 or in the process of determining eligibility. Determined eligible doesn't necessarily mean that they know what kind of services and placements gonna occur for that child. So they do not have to necessarily qualify for extended school year ESY. They just have to know they're eligible for 619. Now, I will say in most cases, when that child is in that about 25% that went ahead and transitioned to the school district for services, most of those children have the April 1 to May sometime in May birth dates. So they're able to get their transition planning done in February, March, April. The school is prepared for them, or they'll have services ready. The family is ready to transition to that and pick that up. And they may or may not qualify for ESY, kind of depends on what happens and what that looks like at the district level. But it's my understanding that most of them that go ahead and transition have an earlier birth date, and they might be able to consider ESY once they've had them in there for a little bit.
Great. Sandy, we had a question from ESIT International wondering if they can get a copy of your template. Could you possibly put the link in the chat for them?
Yeah.
Thanks.
Kathy,
Yeah,
I think we have a question from Cindy Brown.
okay, scrolling down. And
She raised her hand.
raised her hand. Okay. Sorry, folks, when you have 50-some people, I've been scrolling through here, but it takes a while.
Hi, Kathy and Evelyn. It's Cindy.
Thanks, Cindy. Scrolling through this many names is not being very
Yeah.
efficient, I'm afraid.
So a follow-up for Pam, because we're dealing with this in Delaware right now. We're looking at some policy changes. Of the kiddos that do opt to transition at age 3, do the schools find them eligible to begin with extended year services, or do they have that gap of nothing in the summer and wait until fall?
Hi, Cindy. That's a really great question, and I'm not sure I can answer that on a statewide basis. Again, I think it kind of depends on what's available in the school and how the child is performing when the child enters into the classroom, or if the services are itinerant services, what that might look like to be able to be provided over the summer. Because we do our transition meetings like all of you do 3 months or more in advance of the child's 3rd birthday, and we also, once the child is eligible for 619, the school district must continue with the IEP development within 30 days of the eligibility determination. So they'll have that plan developed regardless if the family wants to pursue Part C or extended school year through the district, if that's offered or if that's available. We have had some situations where the family went ahead and transitioned to the school district, thought that they might get ESY, and the child was doing really well, and I don't think ESY was offered, and they wanted to come back to Part C. And we and that page that Kathy shared that's on the ECTA website, we in our policies we say, you know, once you choose to go to Part B, you can't come back to Part C, and that was something that we've articulated to families. There is a family handout on that website that Kathy had links to at ECTA to our website, and that options handout has to be explained to the families prior to them choosing where they want to go. So yes, the district would have to have that service considered just like they would for any other child that's in their program, you know, at the end of that school year, whether or not they need ESY. But for Part C, that really isn't a specific consideration. It's just we have to know they're eligible, and then we can offer that extension to the family.
Right. Thank you. That's interesting, and it's very similar in Delaware. I think one of the big barriers, and maybe for the larger group, is those kids with summer birthdays that you know, the districts, there are prongs to eligibility for extended school year. And some of the pushback we're getting here is, well, they haven't actually had an IEP yet, and they really hang their hat on the regression recruitment standard versus perhaps severity of or impact of disability, or you know, if they're on the brink of a breakthrough or a benchmark. So
Yes,
that's a real challenge here. We're looking at, as I said, a policy change in Delaware where children have been able to remain with Part C, albeit they're supposed to be getting FAPE via the IFSC, and that's challenging for a number of reasons. It has been costing the Part C a lot of money, so they're looking at discontinuing that. But we, I think everyone's very concerned about what will happen to kids in the summer if the districts aren't real keen on having a percentage of kids that really shouldn't go without services start with ESY. That's just going to create a gap that we don't want. So if any folks have any experience or thoughts on that, we would be wide open.
So just a quick follow-up, Cindy. We attempted to implement, instead of continuing with Part C, we attempted to implement the FAPE at age 3 or FAPE through the IFSP at age 3.
Right.
It was just because of our infrastructure, like I mentioned, we don't have our LEAs as our service coordinators. And so it was a whole nother layer of structure and policy that was confusing. It cost a little more to do that. And we couldn't charge family cost participation fees because it was FAPE. And so I think we tried that 1 year and then we said, it's just too much. So we went back to the extension plan.
Thank you. I mean, maybe that's something Delaware has to consider, because I think people get easily confused. I think people think it's an extended Part C option where it's really basically been FAPE by an IFSP, and you're right, we don't have the infrastructure here either to do it properly.
Yeah, and the regulations are pretty clear on the distinctions between FAPE at age 3 and a continued Part C program. And so it was a good fit for us to just continue in Part C and then transition later. And like I said, the districts probably hope that we could do that for a larger group of children, because it really does aid in their planning and preparing for the following year.
Thank you, Pam.
Good question.
Thanks, Pam. Miller from Maryland, you're unmuted. Can't hear you. I've unmuted you. You might need to unmute yourself. Okay. Pam, you want to try again? Christine, could you possibly help me with this so I can continue?
She's unmuted on our end.
Well, maybe Pam's changed her mind. Any other kind of questions or clarifications? Oh, Alice, you have a follow-up. You can talk if you'd like.
Can you hear me now?
Yeah.
Oh, good. I was just afraid of speaker mic feedback. Okay, so when I talked to OSEP about whether or not we could pilot the extension process for Part C, I was told no, we couldn't do that, that it had to be statewide or none at all. Because we were thinking, well, maybe we could try it in a couple of districts. But Pam, it sounds like you guys have found a workaround, which is you're not necessarily doing it for all children who turn 3. You're just doing the summer birthdays, which I like. And so I'm assuming that you guys were funded using that extension funds from OSEP to do this?
Hi, Alice. We like I mentioned earlier, we were doing some portion of this when the regulations come out. We had to try to fit that into the regulation for an extension plan. I also mentioned we are not fully implementing option 1. We are doing it statewide. All children in the state have the option. The families have the choice if they want to participate or if they want to transition to the school district. So it is a statewide option, but we are not fully implementing option 1. So we did not get funding, that extra funding portion that they had available to states who have one of the 3 options on the slide that I had showed you earlier. We did not get that because in order for us to get that, I think it was about $300,000, we would have to fully implement option 1. And like I mentioned in the other slide, that's a little bit more cost than $300,000. I think it was closer to $5.5 million to do that. So it's a great opportunity for states that are already fully implementing one of the options. We are not, but we did have to have a policy because we were implementing services over age 3. And we are doing that statewide. All families have that choice, but we are not doing it for all children from their 3rd birthday to the following school year. We would love to get to that point in time to be able to do that for children who are 3. That's always something that we've kept on the back burner. But goodness, just with the children that we have now and where we predict it's going to go, we're going to have a lot of money just in services for children up to age 3.
Yeah, and just to follow up, I don't know if anybody from OSEP's on, but it seems like states might be willing to dip their toes into this water the way you have with a particular birth age grouping or something, but to really require you to dive headlong into the whole thing, I think in order to get the funding is probably onerous on most states. So I like this possible middle ground. Thanks.
Great. If you need any of any of our policy information, just let me know. I'd be happy to share.
You can just go ahead and send it to me.
I will do that, Alice.
Thank you.
I will do that.
So, do any of you have some strategies that you might want to share? New Mexico has really created an extensive infrastructure over the last, gosh, Sandy, what, 15 years? You were a Project STEP state back in the 90s. And I'm wondering if there are other states that have been doing some things with local agreements or have considered transition consultants, or if there are just other things that you have done to try to address this notion of summer birthdays that you feel are worth sharing. We'd love to hear from you.
All right, this is Alice, and since I'm still unmuted, I'm going to use this opportunity to say we built it into the PDG grant that we just got as far as building local transition teams. And so there's $300,000 that we're going to use for transition. Alice,
you bring up a really exciting source of funds that Part C and Section 619 are important members of the preschool development grants, birth to 5. This is just such an exciting opportunity, and I believe 45 states were funded, and many of those states will be doing a needs assessment in year 1 unless they can show that they have done sufficient needs assessment work and can begin strategic plan development and interventions. So I'm really glad that you brought that up, and what a great use of resources since this is a birth to 5 initiative. And also that you're at the table. Very exciting.
And then I'll just add one more. I'm sorry, but this is the reason we are in the Office of Early Childhood. And as they were doing our CCDF Child Care Development Fund plan, we did a lot of work about how we could use our SIMR and our SIP to partner with them to train child care centers, because we're not just doing transition with families, we're doing, and LEAs, we're doing transition with child care centers when these kids turn 3 as well. So
Thanks for sharing that, Alice. It'll be interesting to hear how that work continues. Are there other folks who are aware of the PDG grant Birth to 5 that has been submitted and probably funded by your state, where you might see real opportunities for transition and inclusion and supporting social emotional development? And big part of this is supporting families and family engagement, which is key to the transition work. I think we'll be hearing more in the future. It's really brand new. And if you weren't involved in the planning, or just the timing wasn't good for you to be involved in the planning, we encourage you to really reach out to your early childhood partners in the state and participate in that work, getting in the beginning. Sandy, is there anything else you might want? Oh, Cindy says Delaware got one, and CN 619 will be very involved doing the needs assessment first. Congratulations.
Well, and Kathy, New Mexico received an award, and both Part B and Part C and the Children, Youth, and Families Division all received funding from that. And so they're working now to roll that out, and a lot of it for Part C is around professional development activities.
Mm-hmm.
But it's exciting, and as you said, we'll know more as time evolves.
Yes. Sandy, is there anything that you have been thinking about that you wish you had said or that you would want to add before we close the webinar? And the same for you, Pam. Any kind of final words?
You know, one of the things that I think comes to mind just recently in kind of just south of Albuquerque, where our center is, we have a transition team that was having some issues around timely transitions and getting children, you know, eligible by age 3. And the team came together, and my cohorts here, Catherine Quick and Jonetta Martinez-Pasillas, went down for the transition team meeting, met with all of the parties involved. They reviewed their MOU and kind of hammered out where things weren't working well, and agreed that the Part C and the school district are going to meet on a monthly basis just as they, you know, start figuring things out and trying to improve practices. And I think this was just another example of how effective those community transition teams are.
Mm-hmm. Thank you. Good things for families.
Yes. Yes.
And good things for local programs too, in terms of building strong relationships that support families, children, and their program staff.
Right.
Well, we want to thank Pam Thomas and Sandy Drangmeister and her colleagues from New Mexico who are in the room. We want to thank you very much for the time and the effort on this webinar today. We're really excited to be able to support you in sharing your work. I want to thank Evelyn Shaw for helping me today, and Christine Wagner. We will have this posted shortly. If for any reason somebody needs the PowerPoint right away, I can send it to you as a PDF. But if you can wait, it really won't be long before it'll be available. And with that, the last thing is that you will be getting a link to an evaluation, and we really do appreciate your comments and your feedback. And I hope everybody has a good week. Thank you, everybody.
Thank you. Goodbye.
Bye.